Well, good afternoon and good morning to some. Welcome to Head Start and COVID-19, a symposium on vaccination and community mitigation efforts within Head Start. I am Bernadine Futrell, a proud member of the team here at the National Head Start Association, and we are very honored that you would join us on today for this conversation. And we also welcome you to help us create the next iteration of this conversation. Today's meeting or today's symposium, the purpose is really to bring us together, to be united, to be a community in search of answers and a community in search of what we can do next. I can make two promises to you from this event. The first is we're not going to answer all the questions, but the second promise is that you will leave, it is our hope that you will leave empowered with additional questions to ask and also points to share when you are in various situations with many stakeholders looking to you for leadership. There is no doubt that this has been a very difficult time over the past year or so, and there is no doubt that it's even more difficult when you sit in a seat of leadership. Your community is looking to you to lead as well as looking for you to navigate out of the storm. And so we want to say thank you for all of the work that you've done in showing your leadership and being a part of what makes Head Start strong. So before we get started with today's event, I do want to just take a moment for us to pause, gather ourselves, and just kind of reflect and get ready for this moment, and then also think forward towards the future. Thank you. Now, it is my great honor to introduce a colleague, a wonderful leader, a true champion for children and families, the Executive Director of the National Head Start Association, Yasmina Vinci. Yasmina?
Thank you, Bernadine, and thank you, distinguished panelists. And most of all, hello and welcome Head Start, childcare, preschool, and pre-K colleagues. So it was over a year ago that the awareness of the dangerous virus began to enter our lives. And it was 11 months ago that we were all sent into lockdown. We were sent into scrambling to figure out how we would continue delivering our services to families and their children. And more importantly, how we would continue our relationships with each other, with our own families, and with the families and children we serve. And that's how Zoom, GoToWebinar, Microsoft Teams, and other platforms became important parts of our own realities. And "you're on mute" became the most heard phrase of 2020. Believe me, I heard it myself. Other than that, there was not much certainty. There has not been that much certainty. About the time that we went into lockdown, someone pointed out that the virus, this threat to our lives and to our ways of life, was universal. But as our board member, Debbie Beeler, wisely pointed out, we were all in the same storm, but not in the same boat. In fact, the virus further exposed the tremendous inequities and disparities between health outcomes and death rates of Black, Brown, and Native Americans, between frontline and white-collar workers, between the young and the old. Millions of deaths worldwide. And we did not know when it would be all over. And all this time, we kept hearing about the efforts by vaccine developers to develop the vaccines that would stop the spread of disease and death. But vaccines then seemed so far away. There was so much we did not know, and instead we worried about our daily and weekly existences, about getting food to the Head Start families, about checking in with our most vulnerable families, about reopening, sometimes closing, reopening again. But suddenly now, here are 2 vaccines and more on the way to approval and distribution. I understand that 31 million Americans, which is 9.6% of the US population, have been vaccinated already. But once again, there is a lot we don't know. Will the same disparities be perpetuated? Will more equity prevail in getting us all out of the pandemic nightmare? So today, we're really very delighted and proud to bring you experts from legal, medical, and of course, early childhood practice worlds to tell us what we know about vaccines and mitigation and what we do not yet know. And then at the end, you will hear how NHSA will continue to hear your voices and serve your needs going forward. So next, it is my great pleasure to introduce NHSA Board Chair Damon Carson, who leads the Neighborhood House Association in San Diego. 6,000 kiddos, 6,000 families are on Damon's daily plate, on Damon's worry list. But Damon has led his NHSA community by example, and he got a vaccine last week. So he is here to share a little bit about that experience. Damon?
Well, thank you, Yasmina, and good afternoon, everyone, to the panelists and all that have joined us from all around the country. Happy post-Super Bowl Monday to everyone. Certainly happy to be here with you this afternoon. Awfully proud just to be a part of this great network of individuals, and I've been asked to kind of share my story on obtaining the vaccine. And as Mina alluded to, I received my first dosage of the vaccination last week, the Moderna vaccination here in San Diego. Essentially, why I obtained the vaccine, there's a story behind it. And I'll try to give you the short version for the sake of time. A week before Christmas, this last Christmas, my family and I, my wife and my 2 children, we have been doing everything we could to respect the stay-at-home orders, to respect the pandemic, to really be safe and careful, not to take extra trips anywhere, certainly to mask up, use plenty of hand sanitizer, wash our hands, not have visitors come into our household. We thought we were doing a great job. Like I said earlier, a week before Christmas, my wife tested positive for COVID-19. Fortunate enough that she's doing fine now. It was a little challenging getting through it. However, my kids nor myself, we obtained the virus. We were tested multiple times, and it really perplexed us as to how my wife was able to contract the virus, and yet myself and my kids weren't, because again, we're a family unit. We've been staying at home together, so it was quite puzzling for a moment. Once we were able to get on the other side of my wife's period with the virus, gave a lot of time for me to do a lot of self-reflection, really around how do I protect my family? How do I set an example in terms of being able to be a leader that really walks the walk? And I really felt like the only way I could protect myself, my family, my friends, and my colleagues was to obtain the vaccine. And so really just took the time to educate myself. Fortunate enough to have a best friend who teaches, who's a professor at the medical school at the University of Michigan. And I really challenged him on some of the questions that I had, even from a historical perspective, being a African-American male, on some of the stories that we've heard over history about the mistreatment of people of color within the field of medicine. So I challenged my best friend, but ultimately I thought it was the best thing for me to do to protect my family, to protect myself, to protect my friends and colleagues. The process of obtaining the vaccination was fairly easy. I was fortunate enough to go through a drive-through experience, very well organized. It just moved like clockwork. How I feel really after getting the vaccine is very relieved. Looking forward to my second dosage. I was fortunate enough to not experience any pain or any side effects from my initial dose, and I hope everything goes well with the second dose. The only advice I can really offer to folks that are a part of this webinar and are entertaining the thought of possibly getting the vaccination is really to truly educate yourself. It certainly is a personal decision that we all have to make, but use all the tools that we have available to us to learn as much as you can about the vaccination and make an educated decision. Now, we don't have all the answers, but we do have a community, and as a community, we're certainly all strong. I want to thank you for being a part of this nationally recognized efforts to keep children and families safe and healthy during this time. Certainly things will get better, and I stand here with you. Now back to you, Dr. Futrell.
Thank you so much, Damon. We are grateful for your leadership, both at NHSA as our board chair, but also your leadership at in your San Diego, California. And I'm smiling because there's a photo of you, one of the celebrities who were vaccinated here that we're displaying. So thank you for sharing, and our best to the recovery for your family. At this time, we are going to begin the conversation from a legal perspective, and we have the title is Vaccinating the Nation, What You Need to Know, the legal perspective. And joining us is David Kaufman, who's the Director of Global Strategies from Nixon Peabody, Chris Mason, who's also at Nixon Peabody as a partner, deputy leader, class actions and aggregate litigation leader, and Sarah Swank, who's counsel at Nixon Peabody. So please join as we give a virtual welcome to this wonderful team to share what we need to know, the legal perspective.
Thanks. Can I share my screen? Wonderful. Okay, hope you can hear everything. My name's David Kaufman. Really delighted to have you be here today with my colleagues. I'm really wonderful to participate in this program, and we are here to talk to you about something very important, vaccination. It's something that I think early on our firm, we're from a big international law firm, but we've been spending a lot of our time working with clients all over the country, kind of dealing with this pandemic. And one of the things that we saw early on was that the vaccines could be a light at the end of the tunnel. And we're very excited about that. But as we started thinking about it, we started realizing that it's not going to be easy. It's going to be complicated. And there's a lot of legal issues that are going to be involved doing this. And so we needed to get prepared for that as we kind of chart our path. And at a law firm, we have lots of really smart people. I think I'm delighted to have with me two, I think, of the smartest we have. Chris Mason, who's a partner in our New York City office, and Sarah Swank, who's in our Washington, D.C. office, and they bring kind of different perspectives, having working at different parts of our firm. Sarah is from the healthcare, has a lot of experience working in healthcare issues, and works with hospitals. So she's going to talk a little bit about some of the, how we got here, where the vaccines came from, and what we can be thinking about the vaccines from a medical perspective. And then Chris, who is a really great business advisor and lawyer, will be talking about some of the, what you should be thinking about in terms of your employees and kids getting vaccinated and lots of those kind of issues that we've actually been thinking about for quite some time. We don't have all the answers, unfortunately. I wish I did. I wish I can tell you this is how it's all going to play out, but it's not like that, and it is a very kind of complicated situation. We're putting on a program in about a week called Vaccinating the Nation, which we go a little bit more deeper into what we're talking about, and hopefully we'll know actually just another week. Maybe we'll know more information too. So we invite all of you to, it's free. And also bear in mind that this whole slide deck will be available for you. So you don't have to be, taking screenshots or writing things down, scribbling things down, things like that. We'll provide this whole slide deck, all this information for you that you can have and you can consult with. So we're going to be talking a little bit about what's happening with the vaccines, what the law of the land will be for students. Can the government require employees to be vaccinated? That's something that we're hearing quite a bit about. What about parents and other volunteers? If the law does not require vaccination, can we require it? And what are the other things that you should be thinking about? So we're going to continue to be thinking a lot about this, but we're going to try to give you our best guess of what we think is happening right now in vaccination and things that you should be, what you need to know right now. And actually, I think a lot of things we'll talk about is what you need to be thinking about and what you have questions about, and maybe talk to your board and kind of get your community figuring out. I can say that on the employment front, the conversations I've been having with our clients have shifted pretty dramatically. I think early on, a lot of them were kind of on the idea that they weren't going to require employees to be vaccinated. But frankly, I have to say that talking to a lot of them just in the last week, a lot of them really are moving towards that as they're thinking through some of the practicalities. And we'll see how long that sticks. But I'll turn it over to Sarah, who's going to be talking a little bit about the kind of the medical and some of the important things you should be thinking about with vaccines. Sarah, take it away.
Great, thanks. Welcome everybody. Thank you so much for having us. I'm a health attorney, do health policy. I also have to say I'm a proud friend of one of my really good friends is a health nurse. I met her while working in-house at a hospital, and she was then inspired to go on and run programs where you take healthcare and schools and start working together. And she was inspired by her mother, who was a Head Start teacher. So I come at this really from a health background, but understanding, as Yasmina talked about, social determinants of health and how we're all ultimately trying to care for the same community members. So thank you so much for having us today. How I got involved in public health law was, one, it's a passion of mine, and two, I years ago ran a legal department of a hospital in Washington, D.C. I was there for SARS and H1N1, and actually my original work was on anthrax and some of the anthrax cases that were happening in Washington, D.C. So I used to joke there were things happening in the basement that we had grants for that I wasn't quite sure what I knew I had done the contract for. All that to be said, this is unprecedented in a way that even when we were doing H1N1 preparedness, I don't think anyone quite could anticipate. So I wanted to first start off with, Yasmina talked a little bit about the numbers here. We got a big task ahead of us, right? There's a lot of numbers here. Next slide. But I think really what's quite amazing, because you'll hear from me, I'm an eternal optimist, but also a realist. The idea that we could go in a year and get through the FDA approval process is quite amazing. I will say this, I'm sure we all felt personally and professionally the changes that happened. As a health attorney for 20 plus years, every law that I knew changed. We had waivers at the federal level, and as you know, state law and governor's orders became more important than ever. At the same time, we saw, the FDA get through the approval process of vaccines in a way that was, again, unprecedented. Next slide. So in part of this race to approval, I just wanted to give some context. Again, I don't even try to pretend to play a doctor on television here on your little screen, and I'm glad that you have a medical professional to talk to you about this. But to kind of give context around how long it takes a vaccine to get through, and if you even look at the little tiny dot at the very bottom, there's COVID, and it was a year. If you look at Ebola or measles or mumps or polio, you can see the linkage between the year that the pathogen was linked to disease and the year the vaccine was licensed. So we really are in unprecedented times. What was really interesting was this path of caring about social determinants of health and public health law has taken me, and somehow being a preparedness expert, has taken me on a strange journey, because one of the things I was able to do is to speak to public health workers on the public side and with the perspective of private side. And one of the things I was able to do was to speak to on a Homeland Security webinar or one of these, right? And I could talk about whatever I wanted. Like I could talk about, you know, PPE and anything, you know, how the ICUs were at capacity or what was going to happen next. And one of the things I really wanted to get out there was not just the production of the vaccine, but the actual distribution of the vaccine. So as somebody who studies how our systems work, and you know this too on the education side, it's really complicated. And I really wanted people to, I wanted the government to start thinking that through. Next slide. So one of the things around distribution is we know that there's a limited production.
Sarah, just one before we go on to this. But you know, this was done very quickly, but you think it's safe to the vaccine is safe?
I don't think I was going to say I will not vouch for safety, but I will vouch for the fact that it did go through the FDA process. We should refer that question to the medical professionals, but it did go through a process here in the United States. It was an emergency process, which makes sense given the conditions that we're in, but it did go through a process. As there's more and further information regarding this process, there'll be more we learn. You know, so for example, one of the things that we don't have an answer for is, if I have the vaccine, can I still give COVID to somebody else? And that seems like a pretty key factor in you know, how we're going to change or go back to our what we thought was normal, or back to our daily lives in a way that we're used to, whether that's work or school or you know, we heard that going to the grocery store, this could change a lot, and we're still waiting on information regarding that. But you know, the government, the federal government's recognized that there's a limited production of vaccine and supplies. Even when you think about supply chain, you're not just talking about the actual, like, you're talking about the vial, the needle, the PPE, the freezers in this case with the 2 vaccines that we have. And so it does get complicated. Also the fact that these are 2 shots, not 1, and the tracking of these shots. You probably all have read about some of the criticisms of what's been happening around wasting of shots or trying to track shots. You know, once a vial has been taken out, the timing around it. I think, you know, it's amazing to me that we are in some ways concerned about that. I know I trust our healthcare system in that, you know, they had to pivot and they have to track, but really this is what our healthcare system's really good at, is, you know, it's a little more complicated obviously than a flu shot clinic, but we have, you know, this is sort of the operations that we expect our healthcare industry to be able to do. I think one of the things that will probably help the distribution and production is the fact that there's additional federal funding. I think where we also see concerns are this idea of, like, and we'll talk about this in a minute, like the prioritization. So the CDC came out with a prioritization that was based on these principles of, like, equity and sort of big impact with the vaccine. But at the same time, we've also given some of these decision-making points to the states. So we'll look at that in a second. The other thing I really wanted to talk about, because we talked about, like, social determinants of health and equity, is, you know, there have been tracking of data around race and racial inequities in COVID treatment. And that data, I think there could be more and better data, but there's data out there. And it's even baked into the CDC guidance as well. And you're seeing states that have created committees and task force, and these issues are being looked at. When we were prepping for this webinar, it's something that I feel very passionate about, this idea of making sure that there are equities in the distribution, but also not just access, but people feeling that they can trust the system to receive a shot. And so I really appreciate the personal story we heard. Chris, so what are some of the things we were talking about this? What are some of the items that you've been looking at or have thought of in your professional life, given the positions that you have around equity?
So thank you, Sarah. Damon, I really appreciated your story to us, and I doubly appreciate it because I lived in San Diego at one point. I was a clerk to a federal judge out there, and it's one of the really wonderful times in my life. But I'm speaking to you as a partner in a big law firm, but I have a couple of other jobs. One of my jobs is being the chair of the board of the Presbyterian Church USA. And so we have a number of churches that have Head Start facilities, and we have a commitment to racial equity. And I'm also on the board of the Lawyers Committee for Civil Rights Under Law, which is, we litigate more civil rights cases in the race area than any other organization in the country. And we are, in fact, looking very closely at the issues of racial equity in connection with COVID-19, vaccination, distribution, public health generally. And so I want to tell you that because it's something that really every part of America is looking at. You have the federal government looking at it, you have the state governments looking at it in different ways, obviously, because they're different states. And you have non-governmental organizations, the civil rights organizations like us, like the NAACP, and you're in the front lines of seeing this. So feel comfortable if in your organization, if you see things happening, realize there are places you can go and tell people about it so we can do a better job of dealing with those potential inequities. My organization, Lawyers Committee for Civil Rights Under Law, happy to take information from you if you see something you think is inappropriate. The good thing is it's got the attention at the very top as well. You know that our current president thinks this is a priority in every respect. And so I think you should have confidence that people are going to work on this. I also want to tell you that you should have confidence, although we're not going to give you the healthcare answer, right? Should you get vaccinated, but the confidence level, listen to the fact that Damon was confident doing that. For me, the story I always say is, hey, listen, am I confident about the vaccine? Well, I went and got my mother-in-law vaccinated. And then people say, yeah, but that's your mother-in-law. I said, yes. And right after that, I got my mother vaccinated too. So I have a high level of confidence in this. And I hope that you can take the time to figure it out for yourselves as well. Sarah, let's go back to you and talk a little bit about what the vaccines are that we're actually dealing with today.
Yeah, so if we go to the next slide, right now there's 2 approved vaccines. The Pfizer vaccine, to note, is approved for 16 plus. None of these vaccines are approved in children. And in fact, to the extent you need to, there's a really interesting article out of Boston Children's, in which is associated with Harvard, in which they looked at whether, for example, what are the factors of why we're not doing trials in children. And part of that had to do with the vulnerabilities of older adults and frontline workers as priority. But now, as there are variants coming over from the UK and South Africa, there are growing concerns regarding whether those mutations may end up putting children at risk. So there are clinical trials happening in those. One other thing to note around distribution, so we had to look at how the US gives flu shots and gets access to healthcare. And so there were two pipelines. One was through pharmacies to get to skilled nursing facilities. And this is actually, to me, quite fascinating because if not for a disruptor in healthcare, that might not have even existed. So if we go back, I used to see these slide decks where, if you all remember Blockbuster and the Friday nights to go get your videos, they would put Blockbuster and then they'd put like Netflix that was new and say like they didn't change. And they used that as a disruptor example. Now, what happened in healthcare was we used to all have to go to our physician office and make an appointment and wait. And somebody realized, well, maybe we could do it in a pharmacy. And because of that innovation and change, we now have this ability to have pharmacies roll out the shot. And I would also say that they're looking at loosening and under the PrEP Act, who can actually give the shot and administer it. We're looking at EMTs. There's also some, the getting to people's homes. Not everyone has access, and not everyone, whether they're in a city, like Chris was talking about, or in a rural area, whether, meaningful access as well. Now we're even looking at Yankee Stadium being as a vaccine site. So as we saw testing sites pop up in different ways, we'll see likely testing vaccine centers also popping up in different ways as well. On the next slide. So just to talk a little bit about the CDC recommendations, here's the phasing. What is left out of this phasing is it says essential workers, but we've really looked to the states to define what is an essential worker. And this comes back to what essential workers were under some of the stay-at-home orders and the ability to go to work in the beginning. But we're seeing variations across state to state about that. And the other thing is interesting when we were prepping for this is the idea of people going across state lines and the tracking of this as well. So Chris, do you have any comments around the CDC recommendations and state choices that they're making right now?
Sure. So we've put on our slide sort of the basics that the CDC has recommended, and that word recommend is important. This isn't a law. This is what is being recommended as a best practice. And you've heard in the news stories the phases, and you've also probably seen, if you talk to each other in different states, you've seen that the way this is working is not the same every place. So we know New Jersey, there was a huge news story in New Jersey because New Jersey decided that when it was prioritizing people, it would prioritize people who were smokers ahead of people who were educators. They viewed that the idea of having a risk factor as bad as smoking meant that it was more important for New Jersey to provide vaccines first to people in that condition than necessarily to everybody in the education community. And obviously there were, as a result of that, there were a lot of unhappy people in one community and some happy people in another community. But really the issue here was, what did New Jersey see in its own data that led it to that conclusion? And it turns out that in different states, there's going to be different data. We know in Alabama has had a fairly difficult time with some of its work in the vaccination space. One of the things they did was within what we call phase 1B, which are frontline essential workers, which the CDC thinks of as including educators, they decided that within those lists of people, the educators should not be at the very front of the frontline worker list. And so they prioritized educators a little bit behind other people. Different states are going to have different ways of doing this. It doesn't necessarily mean that one state is doing it wrong and another state's doing it right. It probably means that the states have some different issues they have to deal with, both in terms of their populations and in terms of the system that they're using to roll out vaccinations. So to give you another example, in New York, we know that the governor sort of prioritized hospital systems as a way to deliver the vaccine over some other delivery mechanisms, and that has some consequences about how you prioritize the people within your system. So again, in your own state, in your own community, be comfortable to raise issues with people, but understand that just because one state may do it a different way doesn't necessarily mean that your state's doing it wrong. There's a little bit more to it than that. Last little tidbit for everybody. I would have shared this with Damon, but for the fact he's already gotten vaccinated. Interestingly enough, in phase 1C, which are people with underlying medical conditions, that's the CDC's recommendation for the next group to come forward, and quote unquote other essential workers. Guess what? Lawyers get to be considered other essential workers. So Damon and I would be there if Damon hadn't already gotten vaccinated. Next slide, David.
Yeah, I think that's great, Chris. I think one of the things a good point about the fact that there's no right or wrong answer. I think states are really struggling with trying to figure out how to quickly get the vaccine out there. In California, as an example, we were slow on the uptick here, and they tried to make it simpler by just putting on age restrictions. But now they're hearing from the disabled community, wanting to see how they can be part of it. But part of the challenge of opening it up to disabled folks is to how do you prove that? What is the documentation? They view age as easier. You just show them your ID. So it's a bit of a challenge.
It is. So one way that you can solve challenges like that, of course, is you could just have a law. right? So all of you in the Head Start world are familiar with the fact that there are states that have vaccination requirements. In fact, all states have vaccination requirements for primary school and preschool students, right? The exact vaccinations differ a little bit from state to state, and the reporting requirements on that differ from state to state, but every state has it. What no state has yet is a COVID-19 vaccination requirement for their students. And the reason for that is pretty obvious. We don't have any data of any quality whatsoever about how this works in young children. But once we get that data, you could suspect that states might well move forward and require that as a vaccination for kids. That's not a this year issue, probably, but it's something to keep on your radar for the future. The other thing, of course, to think about is no matter what the vaccination plans are, whether they're for students, whether they're for teachers, whether they're for people generally, states all have exceptions to the vaccination requirements. So we've got 50 states in the District of Columbia. Every one of them says there's an exception for medical reasons, which makes sense. If you're going to be having a reaction to the materials in the vaccine and it's going to cause you to go to anaphylactic shock, you don't have to take the vaccine. Pretty straightforward, right? 45 states have a religious exemption, and how that's measured is a little bit different from state to state. 15 states have what are called philosophical exemptions, which are basically, for various reasons, don't believe it's appropriate to be vaccinated, but my belief is not based on a religious belief. These aren't constant. They can change, and they change sometimes pretty rapidly. So New York, for example, in 2019, we had a big measles outbreak in Brooklyn. And the governor of New York said, we're going to do away with the non-medical exemptions for vaccination. So that if you don't like being vaccinated, you don't want to be vaccinated, it doesn't matter. We can require you to be vaccinated even if you object to it on other grounds. So the COVID-19 vaccination regime, when it comes to your students, you'll have to look and see what your state law requires, but it's probably going to be, if it's required, it will be something that has exemptions, certainly for medical reasons. Likelihood is in most states it will have a religious exemption, and in some states it'll have a philosophical exemption. Next slide, David. So think about the other people in your facility who aren't students, right? Who are not the kids. Can the government require all of the employees, all of you, to be vaccinated if you work in a Head Start facility? The answer is the federal government might have a little trouble doing that. But interestingly enough, the state governments have a pretty clear path forward to doing that if they want to. And why not teach all of you some constitutional law, right? It's kind of fun to learn in the midst of a pandemic. And the constitutional law, and this goes back a long, long way to one of our other sort of problems, which was smallpox. And way back in 1905, the United States Supreme Court decided that states, in this case that would be Massachusetts, could require their citizens, all of them, to be vaccinated, or in the case of smallpox, inoculated, for the slight difference between vaccination and inoculation. And that decision, which was a case called Jacobson versus Massachusetts, has been used over and over again by states to support the idea that they can require vaccinations. And they can do it pretty quickly, as we saw, for example, with polio in the 50s. Some states have already decided that you're going to have employees vaccinated for various things. So in California requires not only students in preschools, but teachers and, in fact, volunteers who work in preschools to be vaccinated with a whole bunch of different vaccines. Of course, they don't have anything yet on COVID. It's just too new. But I would suspect that you can look forward to the day when California in particular, but some other states as well, may well require vaccination for people who work in Head Start. It's just going to be something that you're going to watch for, again, on a state-by-state basis. And you sort of wonder, why is this a good idea potentially? Well, one good reason it's a good idea is that if you require by law that people be vaccinated, this means that if they have a reaction to the vaccine, it's going to be covered by workman's compensation insurance. And you know, in operating a facility, that's a good thing for two reasons. Number one, it's good because it means that if somebody gets sick because of a vaccination, they know they're going to get some money because of that. It's also good for the facility because you know it means that that insurance program will provide the money and there's not going to be a lawsuit against your facility because the person was vaccinated. So that's one reason why people may well want, from a state-by-state basis, actually have a law on this, and there's some good reasons for it. So next slide, David. Let's talk about for a second the people who aren't employees. Let's talk about parents and volunteers. And you know, in the private world of corporate law and so on, people sometimes forget how important the volunteer aspect to a lot of what we do in America is. We are the country that sort of, you know, invented volunteerism. We, more than any other country in the world, include people in as volunteers in important tasks, such as education. And it's a big part of Head Start. So could the government require everybody who's a volunteer or a parent who shows up in a facility to be vaccinated? They could. Federal government's not going to, most likely. The states are going to be mixed on this because California already has a law requiring volunteers to be vaccinated for some other things, like the flu. California might well add COVID-19 to that list in the future, but most states probably aren't going to do it, which means you're going to have some decisions to make about what your own policies are going to be. So David, next slide. And that, obviously, the first thing about a next policy is maybe I can just make it simple. Maybe I can require everybody to be vaccinated, all my employees, all my volunteers, and then somebody's going to say, well, of course, why not all of our kids? And the answer to this is going to be pretty simple right now on the kid side. The answer is no, you're not going to be able to require it. There's no basis for it. We don't have the data. For employees, if you wanted to require it, the answer is also probably pretty clear, which is yes. If you wanted to require all your employees to be vaccinated, you could pretty certainly do that. And we've seen that in other situations. We've seen it in sort of the daycare world with KinderCare, which went through a really quick requirement of vaccination for all of its employees in response to a measles outbreak. It's something that we are seeing private employers in the corporate space start to consider. We've seen one large law firm that's like our law firm has already decided it's going to require all of its employees to be vaccinated before they go back to the office to work. So it's something that you really could consider, right? And you could consider it with parents and volunteers in the same way. If you have somebody coming into facility, you know, being in contact with other people in the facility, even if you're not paying them, could you require them to be vaccinated to be able to come in? Yes, you could. Now, the really big deal about this is if you set a requirement and you start getting information about whether people are vaccinated or not, you just have to remember that's private health information. So if you're getting that information, you're going to have to do certain things with it to, you know, treat it properly. But you can overcome that if it's a rule that you want to set. For me, the more important question is, if you set a rule, you really need to make sure you keep the rule, right? So in the little deli next to my office, it's a very tiny little storefront, and it has on the front door, it says no masks, no gloves, no service, right? And that sign was put up at the very beginning of the pandemic when everybody thought that if you touched something, you would instantly get the virus and die. Now, my deli does make people wear masks when they go in, but they have stopped making people wear gloves, and they're really not enforcing that. So they should not have that sign up. They should just say no mask, no service. Same thing's true for you. If you make a rule and you decide that you want to have everybody be vaccinated of a certain group of people, you actually need to follow that rule. And if you don't follow that rule, that's going to put you at risk. So just think ahead when you're planning on this stuff. Most of the people we deal with right now have not yet said that they want to require all their employees to be vaccinated. Very few of the people we talk to have said that they're thinking about a rule that requires every visitor to be vaccinated. Although you could imagine such a rule. Just start planning for what you're going to do and see what the right thing is for your particular organization. And again, state by state, locale by locale in terms of how it really works. Next slide, David. So these are some things we're seeing, but then we're hearing from people, and it's interesting what you don't hear. And for you, some of the things that we don't hear are things you should pay attention to. One of the things, I do a lot of work in the area of big class action lawsuits about false and misleading advertising. Everyone on this call has been in one of my lawsuits, okay? I can tell you that because I've had lawsuits that covered almost all the major telephone companies everybody's ever had a driver's license, and a whole bunch of other consumer products. So you've been in one of my lawsuits. Advertising is a big issue. Lots of people are starting to talk about how, oh, we're going to require everybody to be vaccinated. But remember what I told you, if you have a rule, you better follow it. If you say everybody's been vaccinated and you don't require that, you're going to be misleading people in terms of advertising the safety of your facility, right? Second, we don't know that vaccination actually stops the spread of COVID. There's some data about that, but we don't really have good data yet. So the idea that saying everybody in my facility has been vaccinated would somehow make people think it's safer for them to come to it. We don't have the data for that. So you need to be really careful if you decided I'm going to put in a rule that says everybody must be vaccinated, and then I'm going to advertise that so everybody will feel very comfortable that my facility is safe. There's a gap there in the science. That means that you have to be very careful about doing that. Same thing's true about emphasizing cleaning and sanitation. We see that even on national television advertising. But be careful about that. You know, having good sanitation, following CDC guidelines, all those things are good things. And it's appropriate to tell people that you do them. But again, if you tell somebody you're doing it, make sure you actually do it. The other big thing, and then I'm going to turn it back to Sarah to talk about this some, is people need, because we don't have good data about whether vaccination prevents you as a vaccinated person from spreading COVID-19, you need to continue your current practices. You need to continue to follow CDC guidelines as if you weren't vaccinated, right? The Occupational Health and Safety Administration, which is the government's big federal organization that talks about workplace safety, they've issued guidance recently that, you know, our firm has talked about that sort of emphasizes this, right? Don't distinguish in terms of the masking, for example, between workers who are vaccinated and workers who aren't vaccinated. Workers who are vaccinated need to mask up as well. You need to maintain social distance as well. The CDC itself is saying we just don't know yet whether getting a vaccine prevents you from spreading the virus to other people. So it's all back to the public health world. Sarah, talk about that.
Okay, great. Next slide. So like what Chris said is very true, and is that, and it's interesting. I just read, I think it was a Wall Street Journal article on we may have to go through the stages of grief again as a country, because there was a lot of racing to this vaccine, and now the idea that people may still be required or should, for public health reasons, wear a mask, socially distance, wash their hands, and that's likely not going away. And even that there is some scientific evidence that the vaccine may be with us longer than we had hoped because of the spread. When I think about education, again, I think about this overlap with healthcare and how we work together in communities, and also some of the similarities of what happened with the pandemic. So everything from realizing that broadband was causing access issues, right? The fact that you can't access healthcare and education in very similar ways, that is likely to be a priority, hopefully. It's definitely been advocated to be listed as a social determinant of health because of the need to access telehealth and other monitoring services digitally. I also think there's a lot of synergies as well. Like if you look at, again, I'm an optimist and a realist, but if you look at, for example, the fact that we interrupted homelessness in a way that like we never thought we could, where we have people living in housing in motels and hotels, and this, to me, the second I heard that, I thought, oh, this opportunity to like actually assist people that we may not have otherwise assisted. At the same time, those are the same. We have kids at home who are in crisis because they're at home and their actual schooling and what was actually good for them was interrupted. President Biden announced this need to get children back to school as a public health care issue, and so we'll see what happens. We saw there's going to be the same balance of public health and safety and economics, and all these are going to play out again, even in a new administration, of course. Next slide. One of the things that I I've been thinking about, and here's a quote. I used to love sci-fi when I was a kid, not as much as a grown-up, but this is the author of Dune. And yes, I watched the movie, which had Sting in it, so that's the age group I'm thinking of. But it says there is no real ending; it's just the place where you stop the story. And for me, what that means is I think we all know some of the issues that we're working through, and there really are these opportunities, but there also are these there's obviously these problems, these systemic problems that overlap. And so if I had one plea, it would be, as Chris said, advocate at your state level, advocate at the federal level, partner with your communities, because it isn't just a teaching issue and it isn't just a healthcare issue, it is our communities and at each individual community level. And the other thing that I would say is in healthcare, what hospital systems, even the ones that are vaccinating their employees, had to do was there were so many people that were for it and against it, and these feelings were very strong, was to create community engagement plans and community outreach to their communities. And just being very transparent right now and consistent, like Chris said, I think is really important in these times. Oh, and I should say one other thing. Somebody asked me, does it end? Does a pandemic end? It does. H1N1 ended. It ended. And there's talks even in the federal government about, what do we do? Because we have all these waivers and people are in compliance or not in compliance, and it's going to be on or off like a light switch. And so there is discussion in DC about what do we do? What do we do so we can ensure some consistency and in transitioning out of some of the legal changes? So.
Well, we're hoping that there is an end to this and that we will find some way to move forward. But we've tried to give you some of our thoughts on what's happening in vaccinations and some of the issues you should be thinking about. Again, this I think this Frank Herbert quote is correct. There's no ending here. That we don't have any definitive guidance for you at the moment. Just things that you should be thinking about. We kind of laid the groundwork for what can happen in your state, in your location. Some of the things that, so I think it's now incumbent upon you to go back, talk to your board, talk to your employees, see what their comfort level is, and kind of make some decisions based upon the fact that, we will be getting some additional guidance from states and maybe perhaps the federal government going forward. But this is a, ever-changing landscape, as this virus has been for almost a year now. But it was really great to share with you and talk to you about what our thoughts were, and look forward to continuing the conversation.
Thank you so much, David, Sarah, and Chris. Wonderful information. We really appreciate it. You gave us some legal lenses to look at what's in front of us. I do want to lift up, and we will send it out, that you all are doing a full webinar on this topic. I know we just touched it at a high level, but we will share that for anyone that would like to kind of have a deeper conversation with this wonderful team. Thank you all so much. We are greatly appreciative for your service and support of the Head Start community. Thank you. At this time, we want to just pause for a moment and kind of center ourselves or set the stage for the conversation from the practical perspective. And to do that, I'm going to invite two wonderful Head Start leaders to join us. Michelle Homowitz is the Executive Director for the Massachusetts Head Start Association, and Amy Corview is the Chief Program Officer for First Things First, and they're going to talk about why we are here today. So Michelle and Amy, we welcome you for your remarks. Thank you.
Thanks, Bernadine. I'm happy to go first real quick. So like Bernadine said, my name is Michelle Homowitz. I'm the Executive Director of the Massachusetts Head Start Association, and they've asked me to speak a bit about what our Head Start workforce and our communities in Massachusetts are facing regarding vaccination, mitigation, and really the COVID pandemic. And so you all know this, Head Start has been on the front line of addressing the COVID-19 pandemic since March, right? For almost a year now. And as our programs and families in Massachusetts like to say, Head Start did not shut down for a single day. Our state shut down, maybe in-person services shut down for a few months there over the spring, but rather, March 11th, when everything went down, at least here on the East Coast, our programs on a dime flexibly retooled to support families and communities in new, meaningful, and comprehensive ways, and have been serving remotely and now in person for many, many months. Our teachers and our staff have been essential workers throughout this pandemic, and they deserve to be prioritized and communicated to by our leaders and our scientists, because we serve the most vulnerable children and keep communities afloat. And I know you all know this. We know that at the same time, COVID and now the vaccine efforts have not impacted all communities across the country equitably, both in the health outcomes of the disease itself or the economic impact of the shutdowns. And unfortunately, it doesn't quite look like the vaccine rollout has been exactly equitable yet, and that's something we are hoping to address. We want to make sure that the vaccine distribution is equitable and gets rolled out to our workforce in particular as quickly and efficiently as possible. We know that our workforce is made up of many, of a high degree of low-paid women of color who are already disproportionately impacted by this disease. And by the economic outcomes of this pandemic, and who work in person every day with children who are too young to social distance, many of whom are too young to mask, and that are really quite impacted by the coronavirus. We also want to make sure we recognize the historic inequities in our country and the cultural trauma that's experienced by Black and Brown communities, and traumas that have been inflicted on them historically by government, by healthcare institutions, and make sure that we address those inequities and that we recognize them and respect them as we roll out the vaccine and treatment and mitigation strategies, and that those are things that we're speaking to. So in Massachusetts, I know we really have two main concerns around the vaccine, and I know these are things that we're going to be talking about and we have been talking about today. The first is really making sure our workforce is prioritized and that these rollouts are logical and accessible and equitable. And we know much of this is going to be at the local and state level. As we just heard, so many of these decisions are made statewide. That's going to require local advocacy with support from our national partners. And the second, a lot of the reason we're here today as well, is addressing the outstanding questions our workforce has about the safety of the vaccines themselves, the trust in the federal agencies that helped administer it and the scientists that helped create it, the side effects, the possible allergic reactions, right? All the questions we have around the vaccines themselves, and the way it was developed and how it was developed so quickly. So that was a really useful talk from the legal perspective there. So we know we're working to address these questions and these challenges regarding the vaccine, but at the same time, programs across the country and here in Massachusetts are working to continue to effectively mitigate the virus within our programs while we're waiting for these vaccines to really roll out. And so those strategies also depend on the mitigation strategies we know have been impactful and useful in terms of masking and distancing, and as well as widespread testing programs with symptomatic and asymptomatic testing. So Massachusetts, we're working to support our programs at the state level to see that our staff is prioritized in the way that they deserve to be as frontline essential workers. And so I just want to thank NHSA for highlighting these needs at the national level and for inviting me to be here. So thanks.
Well, hi everyone. I'm Amy Corvo. I'm the Chief Program Officer at First Things First here in Arizona. I'm also unlike Michelle, who directly works with her local Head Start Association. I am on the board, but I am no longer a Head Start director, but now I am with the state agency who is working to convene the state partners, including our Head Start, around how do we address this as an early childhood community. We are leveraging all the capacity in Head Start that they have, as you know, many health experts. We are bringing together some work around what our local health experts are and our early childhood educators, because we're really working on the vaccine confident piece. So we have been trying to have webinars in English and in Spanish to try to help our early Head Start, our early childhood and Head Start staff really have a better understanding what it is that the medical community is saying about the vaccines, and much of the presentations that we already heard, what does that look like when we're messaging directly to the field? We have also been trying to organize ourselves around this idea of not just the COVID vaccine, which is important, but in Arizona, we actually have a great number of tribal and rural communities that are different than our urban centers. And in our rural communities, they have had to prioritize COVID, and we have seen a huge decline in childhood and other childhood immunizations. So we are trying to work with our local Head Starts and trying to keep that messaging about the importance of childhood immunizations going and helping to build on that. So that is some of the work that we are embarking on here in Arizona. And it's part of, I think, why we're all here today, kind of talking and dialoguing about not just COVID vaccine, which is very important, but really how are we keeping the other messaging going as well about childhood immunizations? How are we leveraging partnerships to get the message out? And how do we address this as a community, an early childhood community, to help our children and families and our employees understand what's happening, what's going on, and how are we commonly messaging that, so that we're not trying to contribute to the information that is disparate or unknown or frightening, and we're really helping them access people who can answer their questions. So that is part of the reason that we're here, going to be participating in the symposium as well. So with that, I think we turn it back over to Dr. Futrell and we can continue.
Thank you so much, Amy and Michelle, and we appreciate you kind of just setting the table for this conversation with the great information you've shared. I will lift up that Amy has a wealth of resources and webinars that you've done and are going to do that I hope we can put a link to that in the follow-up message. And Michelle's leadership across her state has been phenomenal, and so we thank you, Michelle, for being a part of this space as well. Before we transition to the next panel, I do want to just pause and maybe just set the stage a little bit for what's to come. So we're going to hear at about 3:05, we will have a panel about the vaccine is here, now what, a practical conversation. And at 4 p.m., we will be joined by Dr. Julia Morita, who is an American public health expert. She's the executive vice president at the Robert Wood Johnson Foundation and a member of President Joe Biden's COVID-19 advisory board. And she will be joining at 4 p.m. for a moderated Q&A. As we welcome the panel, I do want to pause and invite everybody to take a 2-minute break, to stand up, to get water, to do whatever you need to do, and then we'll get right into this lively conversation, and I will introduce this distinguished panel right at 3:05. Thank you. And as our panel comes, you can cut your cameras on, and we will get started in 1 minute. Two minutes virtually feels like 8. So we'll wait for Christina and Cersei's cameras, and we will get right started with this panel. All right. Well, after that 20-minute break, we just hope that we're modeling good behavior and giving you an opportunity to take a break. I heard some alarming statistics about if you sit still for 1 hour, what that might do to a person. So if you are listening in to us, please stand up and move around also. So right now we're going to have a conversation. It's going to be a practical conversation. So we had the legal perspective, and we had a wonderful table setting from Michelle and Amy around why this conversation is important, what people are doing, and we had great leadership from NHSA's Executive Director, Yasmina, as well as our board chair, Damon Carson, around their own stories through this pandemic and this time. So at this moment, what we're going to do is engage in a panel navigating community leadership and communication, and we're going to specifically talk about vaccine access and equity, testing, screening, and other mitigation measures. So I have some questions for this wonderful panel, and they will respond to each question. But I first just want to briefly introduce them, and they all in their own right have many accomplishments and have done so many wonderful things that I won't be able to say all of those things, but I do encourage you to follow up with them or, get some additional information should you like, because these are definitely leaders to follow. So first we have Dr. Homowitz Brown, who's the Vice President of Institutional Equity and Associate Dean for Diversity at the University of South Florida. He's also a member of the Alliance for Innovation on Maternal Health. We have Christina Tiedemann, who is an Operations and Outreach Coordinator in Anoka, Washington County Head Start, Early Head Start. We have Dr. Nathan Chimillo, who's a Professor of Pediatrics at the University of Minnesota Medical School, a board member of Early Child and an early childhood champion of the Minnesota chapter of the American Academy of Pediatrics, and Cersei Rushing, who's a Head Start, Early Head Start Director for Southeast Alabama Regional Planning and Development Commission. Welcome all of you today to this conversation, and we're going to just get right into it with the first kind of thread of questions about, what we're feeling. And Christina, if I could start with you and ask you the question of how our program communicating with parents and families about their health outcomes, the screenings, the whole child visits, dental, etc., during this time.
Yes, well, thank you so much for allowing our program to come and talk today. Our program has had in-person classes since July, so we are continuing to check in with our families, whether they're in person or if they are doing virtual, kind of half and half right now. So our family service workers, as well as our health coordinating staff, are working with families to continue to make sure that they know that the clinics are open and available to go get those annual exams, or if they need to go get their dentals, checking up with any missed IMs. We also were very fortunate. We have a partnership with a local dental clinic here that's a nonprofit, and that nonprofit was able to come on site with all the different safety precautions and provide dental screenings for some of our preschool students here. So we are continuing to make sure that they're getting the resources they need.
Thank you so much. I appreciate you lifting that up, because I think it's important to remember there are a lot of things still happening, even though we're in the midst of this very, very tough situation. Dr. Brown, if I could invite you to share with us how equity and inequity, rather, has shown up regarding testing, medical care, and vaccination access.
Great, thank you for that. We were here at the University of South Florida, very engaged with the county as well as the city with regard to screening and testing for COVID back in the earlier days. And we've set up a number of different sites, particularly in the communities of color, to get people screened. And we worked a lot of those sites, pretty much during the week and every weekend with our healthcare team. it was very important to kind of do this in the community where people could bring their themselves in and bring their kids in and as well as their parents and grandparents in order to make sure that happens. So we began a lot of COVID education around that time. Obviously, we were trying to prepare people well for the rollout of the vaccine with all of the concerns and restrictions that were put in place by the state and so forth. And I personally actually worked the COVID vaccine clinic on weekends, trying to make sure that we engaged with the 65-year-olds that were eligible. We also began to work with some of our colleagues in the churches. And this is very, very important because when you begin to think about when this is rolled out to children in particular, you have to be in the communities of color in order to be able to kind of get them more engaged and get them ready when that time comes to take the vaccine. So by doing it in the churches, again, we're able to get to a lot of the 65-year-old Black men and women who were eligible for it. And I think this is one of the biggest things that we have to deal with because of access to getting the vaccine, and then a lot of the miscommunication about getting the vaccine. And as you know, depending on the restrictions, we have real challenges. So we began to prepare the community for the vaccine well back in the testing days when we were actually screening. And I would tell you that people wanted to get screened. And at our site, at one of the neighborhood clinics, we had people from the community walking up. We had them coming in wheelchairs. We had them come in families of 4 and 5 in cars. And it really was a way to say, if anyone says that people don't want to get tested and know what what their risks are, that is not true. People in the community want to know, but we think we actually have really engaged the community now for months about their receptivity to being able to receive the vaccine. And so far, what I've seen is that those individuals who are eligible are getting to the sites. The problem that we have, again, with many of our communities, if they have to take 2 or 3 hours to go to one of the sites to get tested, even for their parents, it becomes a real issue. And I had a situation just recently where one of my colleagues literally had to drive his 80-year-old mother to Orlando to get her the vaccine because of the challenges in the various communities that we're facing. And so we're just hoping that when we get to the next groups, that a community will be well educated about the importance of taking the vaccine. And one of the things that I'm using now as one of our tools is discussing the fact that there are new variants and that we want to make sure that we immunize as many of the people who are over 65 as possible, and that ultimately impacts the family. So I've noticed that that people, you know, whether it's your child or your or individuals, they are really taking that leadership seriously in order to make sure they get their parents' vaccine, that they make sure that they can engage with their children and their grandchildren. And that's really the most important thing that I think we've done here.
Thank you so much. And now I'm going to turn to you, Dr. Chimillo. And I have to say, I was inspired by watching your leadership with like changing from being hesitant about the vaccine to getting the vaccine, being a champion for it, and really inspired a lot of what we're doing today. Just kind of watching what you were doing. We built this kind of event, this opportunity for the Head Start community to come together to really identify next steps. And so my question for you, could you share a little bit for those who are probably not following you on social media, your personal story about the initial hesitancy, and then also if you could connect that to the current and historical violations of trust, both for the government and medical institutions, have committed or are contributing to the vaccine hesitancy within various communities.
Yeah, thank you, Dr. Futrell, and thanks for having me back. So as a pediatrician, talking about vaccine hesitancy is not new. It's something that I've been doing every week. I'm in clinic ever since I started practice. But what was new to me was, as the COVID-19 vaccine was kind of first talked about, introduced, it was the speed at which it was being developed, and then some of the science behind it. Particularly some of these newer shots, which use an mRNA technology, which I didn't learn. I learned about mRNA, but I didn't learn about this kind of specific technology in medical school. And so, for me, I've been a strong supporter of vaccines. I believe it's one of the biggest breakthroughs in medical science, to really keep us healthy, give us the chance to live long, successful lives. And so, for me to then be able to have that same level of advocacy, for my patients, for my community, or even just for myself, my family, I had to do a lot of kind of working through my own initial hesitancy. And there was kind of two main things, that I talk about that I was hesitant about, was the speed and the technology. And so I did a lot of education of myself, reading where we were in the different trials, and why we were able to move so quickly through the trials, what the technology really was based on, and the science, which has actually been around for over 20 years, but just hasn't been able to scale up to this size in the past. And then talking to experts in the community that I knew and trusted, whether infectious disease experts. One of the local investigators here that's working on one of the COVID vaccine trials is a Black doctor that I've known since medical school, and kind of really talking to him, getting his input. And I think, it was the combination of these things that allowed me to kind of move from hesitant to really feel like the COVID vaccine is our best bet. It's a lot lower risk than risking getting COVID-19. And so I know from talking about other shots how it's really important to approach it with that kind of, we're all human. We all have these thoughts and questions, and it's normal to ask them. And it's, I think we do a disservice to our patients and our communities when we kind of approach this through like an expert, we know best lens, and kind of poo-poo people's, questions and real concerns. And so I wanted to kind of share my journey and give people the resources that I looked at that allowed me to kind of reach at that conclusion. And, the things that I learned along the way are, one of the reasons it was developed so fast is, three main things. A is just the money and resources that are dedicated to it, right? We just haven't had the infusion of money or the number of brains, the number of scientists all working on one problem at once. The anecdote I've heard on social media is that if you had a bunch of your family members come over and clean your house, it would get done faster, but you wouldn't really, worry too much about the quality, right? It's the same thing here. We have a bunch of people who are able to really just focus on this one problem, and then the money helps it move through these phases faster, where before you might have heard of like phase 1, phase 2, phase 3 clinical trials. Well, in the past for vaccines and shots, you'd have to wait until one was done before you'd start funding the other, because there wasn't the ability for these companies to recoup their money if there wasn't success. But the government helped subsidize it so that companies could move and kind of get these processes lined up in a way that once phase 1 was done, you could go immediately into phase 2. And so corners weren't cut. It was just the resources were put in there so that wouldn't be a barrier. And then the technology itself, using that mRNA technology, allows you to not need certain steps like growing parts of the vaccine in a culture that can take months previously that we didn't have to take this time. And then the third one, which when you hear it, kind of makes a lot of sense, is that we're in a pandemic, and so that means there's virus everywhere, and so it just takes less time for us to know that if a vaccine is going to work, it's going to work, because people are being exposed to it much quicker. But in previous times, those we weren't in these big outbreaks, and so it would take longer for us to know if a vaccine was effective, because we'd have to wait and wait and wait for someone to get exposed to know. And so those three things kind of really reassured me about the speed, and then learning more about the technology really reassured me that it's safe, and like other kind of new vaccine technologies, has kind of gone through the appropriate steps. And so that's really what helped me land on that taking this shot is much safer than risking getting COVID-19. I think what you talk about, what Dr. Brown was kind of alluding to there about our communities that have had historical violation of their trust. It's a real issue, and it's something that, again, I think really the language we use around it is important. I've already seen people starting to kind of like excuse these disparities that we're seeing in vaccination based on, the mistrust, when in fact, like Dr. Brown talks, it's more about access, and that there's a lot of interest in our communities. It's about giving them the same access that other communities have. But the other thing is that it's often talked about like historically, like you have to go all the way back to Tuskegee and that's the root of all the mistrust. But I know from my own family's experience, from experience of my patients, that it's happening right now. There's medical maltreatment right now that happens along lines of race. I see people in the hospital get treated differently. People, when I send them to different systems, or even sometimes within my own system, get treated, have different experiences that I know are related to racial bias. And so I think it's, having to navigate the fact that there is real reasons for folks to be skeptical and have mistrust. We need to have these ongoing and repeated conversations. It's going to take more than just one time, hearing it from, even your doctor. But the hope is that if we have repeated conversations with the community, and you start hearing it from your doctor and your preacher and your best friend and your coworker, that over time you'll see that, and your concerns will be allayed, and that our communities will have the best opportunity to kind of help get out of this pandemic as well.
Thank you. Thank you very much for that. And Sarah C., we're going to connect your question, I guess, to what was just shared. Can you talk a little bit about how you see Head Start's role in communicating about the vaccine?
Yes, thank you. And thanks for having Southeast Regional Planning and Development Organization on the line. I was making some notes. I'm always making notes. We'll make my notes with Dr. Brown and Dr. Mallow, and I'm sure I'll get to Christina as well. And of course, you. What we're doing, I was just taking bits and pieces because I was looking at both Dr. Mello and Dr. Brown and saying, and I was looking at you through the eyes of my parents and my staff, and I was saying, can I trust them? So I was listening, and I saw the sincerity, and I was feeling the sincerity, but I like how both of them said, and this will segue into what you asked me. They said, I like how Dr. Brown said the receptibility, how the families, and even Dr. Chamello mentioned the families. And so one thing with Head Start, what I try to do within our Head Start group is to keep the families, because I already have the staff in mind. But one thing I was doing on that question, how do we communicate about the vaccine, is to keep our family service staff on the front lines of information as it relates to what the CDC says. And I've been doing some reading on the American Public Health Association, and also what our Alabama Public Health Department. So we make sure that they have access to our dashboard, and you see the deaths, you see the information, and we just communicate there. So we'll look at the COVID-19 no different than we look at how we keep our parents abreast of their immunizations for their children, whether it be lead protection, whether it be the measles, so forth and so on. So I just told my staff, what we'll do, we'll take this situation and place it into the Head Start model that we operate off of, whole families, which is one pillar. And I said, so just take that whole family, and when you take that whole family, you put it in there and you just follow the guidelines. And so, and constantly, and like Dr. Brown said, he didn't wait till the last minute. So they were working on a process, and Dr. Mello was saying he was observing and doing his research, and the 3 points, I'm telling you, the 3 points is going to help me convey the message even more. So I was saying, like a parent, well, how come they did this so fast? Now I'm making my notes, and I know because they had the resources. That's one reason. You didn't have to wait because you had manpower, human capital dedicated to this one goal. And what else? You had the capital. So the capital made it possible for them to have that continuous cash flow. And also you had put on there, and it took less because the repeatedness of the virus. So what we do in our program is to communicate, constantly communicate through social media, constantly communicate through word of mouth. We use our health advisory committee. We use our health manager and disability health manager in concert, because we're a rural program. It has Auburn on there. I was associate director at Auburn, then I'm now at director at Southeast Regional. We're in the lower parts of Alabama, so we're not too far from Tuskegee. So that mindset is like, what do you do to convey that this is a good process? So to answer your question, Dr. Fruto, we constantly communicate and update our staff, to update our parents on where we currently are within the vaccine process, and that we'll utilize our local pediatricians, and we utilize our local government partners, and we utilize our local educators, and we just all lump ourselves, and we talk positive about it. So we had to talk positive about why should we wear a mask, because masks are important. So we put the necessary information up on the board. So to answer that question, it's that constant communication of what's going on and making our parents aware that what we're doing is no different than working with the immunization records. And so you trust us, and we build on that trust that we already have.
Thank you. Now, you know, my whole goal in life is I find a good idea and I'm going to tell everybody about it. So could you lift up a little bit the idea you have around the parent COVID packs, and then also the webinars with the local medical community, as some practical tips for those that are listening?
Yeah, what we're going to do, we're going to design a parent COVID pack. And in that pack, and I was talking to our family service manager, and I was going to just do it in a bag. She said, no, we're going to get a book bag, a knapsack out. And she's going to just stuff it with the necessary items of information, of PPE, and it will be PPE for the parents, PPE for the children. I said, well, make it designer mask. Get a parent, adult size, child size mask and put in there. And also what we're going to also do is utilize the social media, and we're going to utilize our health advisory board, our parent policy council group, and convey this information. So, and I'm gonna add another thing on that, Dr. Fruto. What I'm going to do too is, and I was looking, so I had to touch bases with our HR director, because I got to keep that fine line between HIPAA and the staff, but my focus, I'm maintaining that focus on the parents. So I told them what we're going to do, and my HR director and assistant Head Start director and ed manager, they're working on posters that go inside each one of the centers. So I said, okay, that's a great idea. So what I also told them is what I want to do within each one of our centers. I said, this is Black History Month. And so because it is Black History Month, I want in each center, I want a board dedicated that said, I want you to show every Black American scientist, researcher that had a hand in developing this vaccine. And I want you to get the faces, I want you to get the bios and put it on that board. And then that will engage the parents to see, hey, they look like me. That helps them to trust, that build that trust. So we'll do that COVID pack. We'll do the board with the processes, and we're going to highlight every person of color, every female, everybody that had a hand that looks like the people we serve on that board. And it's going to stay up beyond February. It's going to stay up a long time. And so we're going to take that information and add it, and we'll even update the COVID pack. So bring your COVID pack in, and we'll restack it with PPE. Here's some more information. And then I told them also, you may want to do a board. I'll get with our HR and our legal team to make sure, okay, can we post up there that we can say, Mommy Angel took her coronavirus shot, and she'll post her picture up there. So it's almost when the grassroots area, especially in the rural area that we serve, we have to get some creative ideas, and also we'll put that same information that's on the board inside the social media. So through Twitter, Facebook, we're going to highlight the board. They'll see the board, they'll see the information, and then that way we'll continue to break down the historical, because within Alabama, as it is, particularly there's historical hesitancy to trust anything that is authoritative as it relates to the federal government and in your medical profession. So what we want to do is reduce that historical hesitancy and put in there a positivity that this is a virus that, and these three, and I'm gonna highlight those 3 points, Dr. Chamello, that you outlined, because it's gonna help create a positive narrative and remove that negative narrative that people say, oh, we're just going to be guinea pigs. You can't trust them because remember the bad blood in the syphilis testing and Tuskegee. So with all those things, we're going to kind of condense, but always make sure you stand on the 4 pillars of Head Start, particularly that whole family, because that family parent engagement brings in the collaboration within every aspect, within every government unit, every partnership, and we're just going to highlight it that way.
Thank you so much. And that's a perfect trip over to Christina in Minnesota, not Alabama, and just hearing the optimism in your voice right outside of Tuskegee. I think that's echoing what Dr. Chamello shared about, you know, people's willingness to learn more about it. Christina, can we ask you to talk a little bit about some of the collaborative partnerships? I know you were doing a lot of things with the screenings, but if you could talk about what partnerships are necessary to advance the leadership that Cersei is mentioning for Head Start, and what you've been able to do in your program also along those lines.
Yes, thank you. So I am going to just talk a little bit about, we are very lucky in Minnesota. Our Minnesota Head Start Association has been vital for our partnership, along with our local relationship we have with both of our county's public health systems. So kind of the very first thing that has helped us along this journey of getting through this pandemic and making sure that we serve our families is we partnered with Anoka County Public Health, and they kind of went through all of our communication and all of our COVID-19 implementation plans. We made sure we had all those ready to go before we had any of our families come back through the doors at the beginning of summer. So that's kind of the first thing that we found very helpful, is if you've got that relationship with the local public health nurses that are already seeing a lot of our families, because they do qualify for both of those programs. Another thing is Minnesota Head Start Association, right from the beginning of the pandemic, our Head Start director and colleagues, all of them were able to meet on a weekly basis. So that weekly communication, going back and forth, kind of trading information about what are your public health people saying, what are you hearing in your part of the state, kind of comparing notes. And the state of Minnesota too, that relationship with state leaders is key. We had the wonderful opportunity here to be part of a pilot program, actually, that we did on-site testing for our staff members right in our building, which is wonderful. We did not have to have them go off work site. It was free for our program as well as free for our staff members. It was quick and easy. It was just a simple spit tube test. So we have that every 2 weeks. We're still doing that right now. And we are very thankful the state of Minnesota has prioritized educators and childcare workers in licensed centers. So we are part of the pilot vaccination program. So a lot of staff were able to have the opportunity to get vaccinated, myself included. I was a little hesitant at first, but the Mayo Clinic here in Minnesota did put out a really good FAQ video that our HR department sent out. So that's another thing, if you can work with the HR department to see if there is any informational videos. What I liked is it came straight from physicians at the Mayo Clinic. It was not coming from a news source. It was not coming from some perspective that might have a political lens to it. So I did appreciate having that straight from a medical source. That was really good. And I'm just very blessed that I've had the opportunity to be at our organization that has been, from the beginning of this pandemic, they have put in every single protocol, and we've been very lucky with our results. And our classrooms have stayed open at half capacity since July.
Thank you. I appreciate that. And I wanted to lift up the in-person, the testing that you were able to do. I think that's key with the mitigation, because the vaccine is here, but there are a whole lot of other things that are happening pre and post vaccine. And along those lines, Dr. Chamillo, I'm wondering if you and Dr. Brown could speak a little bit about what we know about the variants and what's happening with the vaccines and how that is connecting. I know this is information that is still coming out, but just wondering if you could talk a little bit about the different strands of COVID-19 and the vaccine and how all of that connects, because I'm sure there's some questions out there from our community. And if we could start with you, Dr. Chamillo.
Sure, thank you. And I just wanted to, also lift up some of the previous kind of points that Circe and Christina were bringing about delivering information in the same way that we talk about other public health issues. I think that's really a great point to kind of really show that this is a public health issue, just like lead testing, just like other immunizations. And I think that will really help people break down some of that initial concerns that they have. As far as the variants, as you said, we're still learning a lot about them. There's kind of 3 or high profile ones that have been talked about in the news, what they call, and they're based off of where they kind of first were kind of mostly identified. So one's in the UK, United Kingdom, one in South Africa, and one in Brazil. And essentially, the coronavirus is a virus, and so it's replicating, and as it replicates, it can change. Its code changes in a way that kind of changes either the structure or function of a virus, and that can lead it to have different characteristics in how either it's infected or how ill it causes someone to become. And so, what has been identified as some of these variants, seem to be more infectious. At this point, we're not clear on, there's some studies that say some might be a little more, dangerous from a medical standpoint, and some others say that they don't. But there seems to be some consistency that, the mutations are leading to increase in how the infectious it is, as well as there's some possibility that the effectiveness of the vaccines we developed might be different based off of these variants as well. But it's still very early. A lot of these tests aren't done with kind of the actual people getting the vaccine and actually getting exposed to these viruses. It's more like done in a laboratory. And so we're still kind of waiting to kind of find out more information about that. But I think the overall point is that, the virus, as long as the pandemic continues, kind of uncontrolled, the virus is going to continue to change, and it could potentially change around even the vaccines we've gotten. So we're kind of in this window of time where we're really saying we need to get our vaccination rates up to really kind of decrease the spread. We decrease the spread, that decreases the rate of it, mutating and multiplying, and makes, kind of helps ensure that the treatments and things that we've developed continue to stay effective. And I think that's kind of the main take home here, is that it's just another reason why we need to get vaccinations fast, but B, like you guys have done a good job talking about already, these mitigation efforts are still going to be necessary for some time. We still need to have the masking, still need to be washing our hands and distancing, and then, just getting the vaccine itself isn't going to take away all the risk like, people hope for or maybe have in their mind. Mm-hmm.
Thank you. Dr. Brown?
Sure. Well, first of all, everything's been said has been so helpful. I want to kind of go back to a couple of things in the trust and the misinformation. We have we're just still having to deal with the misinformation, even from some of our healthcare workers who have declined to take the vaccine because it's got emergency use only, and it's not approved by the FDA officially. And there's been a lot going on around here, discussions even with some nurses who have their own anti-vaccine campaign, which adversely impacts our communities more than anything else. And so we are basically doing everything that we can to try to shatter that misinformation. Now, I'll tell you, when I was in vaccine clinic 2 weeks ago, I had one of our male Black nurses who was there with me giving vaccine. And I said, well, have you taken the vaccine? Oh, I don't know whether I really want to take it just yet until more people get it, because I've still been reading a lot of stuff that it might make me sterile. I mean, these are people who are like, said, what? And so you have to kind of know that this stuff is still around there, and we have to deal with it in that respect. And I said, I got my vaccine. We rolled up our sleeves. The dean of the School of Pharmacy and I basically were all over the television, and he's Black as well, talking about, we're just champions for what you need to do. As far as the variants are concerned, we're also trying to help people to understand that the sooner you get this vaccine in your arm, the better opportunity you have of not getting at least one of the new variants. And the new variant really will expose your family to a potentially greater risk. And I think the data is quickly accumulating, as Nathan has said. We just had a 30-some-year-old man Black man who died of COVID in town. I don't know whether it's a new variant or not, but the reality is that it's a challenge. The other thing that we've done this month that you all will appreciate, in order to kind of counter some of the anti-vaccine stuff, I just wrote a piece about Henrietta Lack for Black History Month. And I was sharing with the group, and many of them didn't even know it, and it's been circulated by ACOG. Here her amazing HeLa cells were, I said, do you know that her HeLa cells were responsible for helping to develop the polio vaccine? Do you know that it was responsible for her developing the HPV vaccine? And they said, yeah, really? I said, yes. I said, so when you think about them having this technology to be able to develop this vaccine that quickly with all the money and all the people working on this, I said, I don't know whether her official cells had anything to do with it or not, but the research behind that really laid the groundwork for these type of things. And when they realized that this Black woman is probably the greatest philanthropist that's ever been in medicine because of those cells, irrespective of how they were harvested without her consent. The bottom line is that this is the kind of information that we have to share with our communities. We have some vaccines because of the contributions of a Black woman. It's like you were saying about the scientists, those scientists who are at the FDA and who are engaged in the development of this vaccine. So I use everything in my toolkit. I call it the toolkit. I use everything in my toolkit to really kind of counter the misinformation, to really get out there and be a champion for this vaccine, including the skepticism among young people. My final piece, of course, is that we had the Super Bowl last night, and I was at the Super Bowl because it was here in Tampa, and I had to have had both of my vaccines in order to be able to even get eligible to get in the stadium. And I must admit, even though we were strictly masked inside the stadium, the town was wild. The town was wild. And we are going to see some stuff in the next couple of weeks that we don't want to see.
Oh, wow.
There's no doubt about it. The new variant is out there. We got all these young people who have not been vaccinated at all and didn't really care about wearing a mask even then. But you give them a little alcohol and a little bit of stuff that were nuts. So I know that my streets were just crazy last night, to the extent that I typically go, now this is about me, I typically go to a cycle class on Monday. It's a private club, and a lot of young people in there. I am not going today. I've had the vaccine. I'm not going to go for a week because I know that they were out there getting COVID, and I don't plan to be around them. But again, the idea is to really help to counter the misinformation, to really use our historical precedents to help our communities understand that this vaccine is as safe as it gets, and that it's as effective as it gets, at least for what we think may be some of the new variants. And that's the information that we're putting out there in our in my toolkit.
Yeah, I like that that toolkit analogy. I'm going to use that one as well. And one thing I did want to add too that kind of builds right off of that about these variants is that you could have gotten the original OG COVID, if you will, and you can get sick again with the variants. And I think that's something that I've seen. Some families in my own practice who are like traveling. We all got COVID in December or November, so we're good now for at least 3 months, and we're going to go on a trip. But they could get exposed to the variant. They could bring it back here, and so I think that's the real risk. And vaccination has actually been shown to be more protective than having previously gotten, COVID. And so just because you got it and survived, we still want you to get the vaccine. And then the second thing that, kind of to that, those concerns you hear, I've heard those concerns about sterility, both from men and women's perspectives. But all these theories, if they were true, that would mean that getting COVID also causes those very same complications, right? That's just how science works. And so, you actually are at a higher risk of these complications if you're really concerned about it. And I try to point that out to folks. Like, we've seen that COVID can lead to erectile dysfunction, right? And so, kind of point out what we've actually seen of complications of COVID, and how, the risk of that. And if you're concerned about some of these other risks from the shot, even if they were true, the risk is so much lower than actually if you get COVID and potentially end up with one of the complications from COVID. So I'm that misinformation is real, and trying to kind of redirect it and, not, brush it off, but kind of say, all right, let's assume that, your concern is, valid, but let's actually, refocus the actual risks that we're talking about here.
Nathan, I've even gone back and said to people when I hear this stuff, including from my nephew, I said, listen, first of all, you don't need any more kids anyway, you got two. But then I'll say things like, well, back in the day when people used to get mumps, they did get orchitis, and they basically could end up with infertility. I said, if the vaccine is going to cause you to get sterile, the virus is going to do it. Oh, and then I kind of go back to some of the things that we learned with Zika in terms of how long it stays around in sperm and so forth. So I've used again, I got a big old toolkit. You guys can welcome to it anytime. That I kind of, when I hear these type of things, I just counteract them with the science, But it's going to, especially when we start rolling out the vaccine to younger people, it's going to be very important that we keep very vigilant about trying to counter the misinformation or people who will make excuses and things like that. Because I tell them, I said, you really are hurting maybe your family. You're hurting your mother, your grandmother, and all types of other people if you were to happen to say, well, I've already had the vaccine, and therefore I've already had the virus, so there's no need for me to wear a mask. There's no need for me to do this. There's no need for me to do that. I said, because other people, you're still putting them at risk if you get one of the new variants. Mm-hmm. And so we're doing a lot of that, Dr. Bernadette, and that's hopefully going to get the message around to people.
Thank you. It almost feels like the Cersei, you call it the COVID packs or the knapsack or what have you, is definitely key, because there's a lot of information even I'm hearing today that I didn't know. So I appreciate you all just kind of being so candid in this conversation. I'm wondering, at the final 10 minutes or so of this panel, if you guys would be open to answering a few questions from the audience. I know we have a few questions that we were going to have you respond to about, communicating and getting people on the vaccine. And I think we've talked a great deal about what those strategies are. So if it's okay, I want to just start with Christina and Cersei. There's some questions from the audience asking about some of the things you've done in your programs. And so one comes in and says, can you describe the testing process at your site? Was it rapid or PCR? Is it a sample? What is the frequency? Are children tested weekly, biweekly as needed? So it sounds like someone's developing a toolkit. So if you could just expand a little bit some of the mechanics of that, that'd be great. I'd be grateful.
Okay. Yes, I can go ahead and start. So we are offering it through a pilot program through the state of Minnesota. So the state of Minnesota is the one that initiated this pilot program. They actually reached out to the executive director of the Minnesota Head Start Association. So that's kind of the beginning, is we were able to do this at the state level, which is amazing, and we are very appreciative for this. And how it works is they partnered with, I believe it was Vault, and it is the spit test. So very simple. We had a small committee of staff members who kind of arranged for this, and we get the kits every 2 weeks or so. And we have a dedicated conference space where it is all socially distanced. It is very, we keep everything clean, and we actually do a Survey Monkey where we put the opportunity out to our staff every 2 weeks. The staff members who want to participate, they sign up through that Survey Monkey link, and they can just pick what time, and we try to keep it staggered throughout the day because, of course, we do have children on site, so it makes it a little bit tricky trying to make sure that we have coverage and stay in ratio for everything, but we make it work. And we typically do this on a Thursday. And why we do this on a Thursday is we'll get the test results usually on Saturday or Sunday, and those test results come right to the employee's phone. And so they will know if they do test positive. And again, these are all asymptomatic testing. I forgot to mention that. We always tell them, if you are having symptoms, you should not be at work. Please do not come to work and expose anybody. But if they were to test positive as an asymptomatic COVID case, then they will not be returning back to the work site, and they have to contact us and let us know. So that is kind of how it works for our staff members. It is voluntary. We have not made it a mandatory testing process. And our children are not tested. No, I haven't heard of anybody testing the children anywhere from any of the local programs around the Twin Cities either, from what I know. So that's kind of how we're doing the testing at our site.
Thank you so much.
Yeah, and within Southeast Regional, we use the testing sites that handle our persons when we're hiring them. So you're going through there, so we'll use the same medical facilities that clear our staff when they're hired on, and then the same thing with the family. So what we want to do, we didn't want to create another site within our site, so we just can't continue that partnership that we have with a family urgent care, and we'll send those persons who feel as though that they need to get tested, and they'll go to the same that is familiar. So we want to maintain that familiarity with, we don't want to add any new entities within there. So wherever the parent, wherever the staff is comfortable, that's where we direct them to, because we want to maintain that open communication and trust that we've already established in that. And what we also have done too within our site is to create multiple protocols. And so these multiple protocols range from level A to level D, and whatever the situation, you can read, the center director or the staff can read and say, oh, this is how I need to respond to this situation. And so we make everything plain and clear on that. And also did, I gave them a Friday off within our program, because I knew you were going to be taxed Monday, Tuesday, Wednesday, and Thursday. So I've given the staff that Friday off, and the morale has really increased, because that Friday is used for a professional development day. It can be used for COVID awareness. It can be used to understand the dashboard that's out there. And it also is used for cleaning, sanitizing, and disinfecting, deep cleaning on that Friday. And it found out that once we work with the parents, because we have both pre-insert, we have both face-to-face and virtual. And so whatever the parent wants, we work within that model of Head Start. Whatever the parent wants, we meet you where you are, and we provide the necessary materials and curriculum for you to do that as well. So it's almost like we treat coronavirus as if it's been here since 2020, and we intermingle it and integrate it into the process as much as normal with our facility.
Thank you. Thank you. And just a follow up, can you, the question is, what's the name of the test kit you used, Christina?
Yes, they are provided through the state of Minnesota. So I'm not sure how that works logistically if you wanted to go purchase them as a program and weren't being provided them free of charge. But I believe it was Vault Health, VAULT.
Thank you, thank you, thank you. And Dr. Brown and Dr. Chimillo, can you answer, well, the question is how does this connect, the goals for the vaccine connect with our goals around the flu vaccines annually, and wondering if there is any kind of goal setting connected to that, or is this way more, way less? Because Head Start plays a leading role in that every year, and I think people are wondering just what type of lift they might be looking forward to.
Yeah, it's a great question. And I often point out that, when you're talking about the COVID shot itself, it's different than the flu shot in that the ones that have been approved so far is that there is no, virus. So with the flu shot, there's either kind of a weakened live one in the nose spray or a killed or, dead parts of the virus in the shot. But in the COVID shot, it's actually just kind of instructions for your body how to make a protein that can then help your body identify COVID, right? And so that's kind of one key thing, because I've heard a lot of people are very hesitant about the flu shot because of, you're injecting a virus, and the idea behind that, even though it is very safe and effective. And so when you think about goals, we estimate to kind of get that community immunity level where you could kind of get back to how things were before the pandemic. We need 70 to 80% of folks to either have gotten the vaccination or at least, survive one bout of COVID, to feel like we're getting close to that community immunity level. Usually for the flu, on like a good year, we're like hitting about 50 to 60% all around the country. And we know in certain communities that level is even lower, like 30 or 40%. So the kind of, as far as a push, I think the push is going to have to be, if we really want to get things back to normal. And that's one of the things I try to kind of talk to folks about, like, what do you want to do that you couldn't do all last year? If you take the shot as a community, we have a chance to go to those, graduation parties, go to the weddings, have the cookouts, have the birthdays, and so kind of framing it in that way as well is very helpful.
We do the same thing. Yeah, I'm unmuted. We do the same thing. What I try to do is explain people the difference between the flu vaccine and the COVID vaccine, because they're, again, as Nathan said, the flu vaccine, and there are people who are skeptical of the flu vaccine because they take the flu vaccine and they still get the flu, and they don't understand why they still got the flu. I mean, even the most highly of it. And I say, well, first of all, the vaccine is made up of the 3 previous years of strand. And I say that, and so people will get a different strand. I've tried to explain to them how this vaccine works. And I don't really know that they still get the fact that they may yet still need to take a vaccine every year, because we don't know how much immunity is there. This is not a curative thing of you ever getting another COVID, because we've seen with the mutations and so forth and so on. So that's part of the education. I want to get back to the kids, because our kids are going to school, we find that parents are really very, very good about getting their kids tested, particularly in the community, because they want to know, that their children's risks are fairly low. And since we have this ability to get a test turnaround through Quest that we use within, 3 hours, basically everybody who rolls through the site will have, if they put that information in, at least for us in our on USF's campus, we will be able to kind of know what you were, within 3 hours. You'll get that. And now Quest is a little slower, particularly for the Hillsborough County sites. But even then, we've gotten better at being able to get the people their results, so they'll know whether they're positive or not within 3 days. We can work a little bit better when we're working with various type of entities. And so that's basically very, very helpful for people to be able to figure out, oh, I can go through one of the sites and get my kid tested. We'll know, and we have people who come through the site every, they'll go every 2 or 3 weeks, because they're out in the workforce. I mean, they are the ones who are really, and that's the other thing we need to say, that many people in our community are what we call essential workers, for places that are open. And they live, unlike me who lives alone, I mean, they live in the house with several people. And that's so important to help them to understand how they're protecting each other.
Thank you. Thank you. I wish we had time to answer all of the wonderful questions that are coming in, but I'm hopeful that we'll be able to continue this conversation. We have, at the end, we'll talk a little bit about how NHSA plans to do that. I do want to say thank you to each of you for answering the call to say, hey, we don't have the answers. We're not sure what we want to do, but we want to bring everybody together. So thank you so much for being a part of this panel and being a part of this conversation. We're very grateful. And for everyone that put in a question that we didn't get to, we will download them and share them with as we consider the next steps for how we get information out to our community. So again, thank you all to this wonderful panel. I learned so much just sitting here hearing you, and I know I talked to most of you before today, so I appreciate the learning that I have gotten, and thank you on behalf of the Head Start community for your service and your support. Thank you all.
Thank you. You know, Super Bowl Monday should be a holiday. But
I'll sign it. Thanks for having us.
It is. It is. Thank you. Thank you. And I guess go Tampa, right? All right. Well, everybody, thank you so much for staying with us. We have a wonderful opportunity to hear from Dr. Marita. Well, hello. I see you on the camera there. We're going to just transition into what we're calling a moderated Q&A conversation. And if you are sitting, feel free to stand up and move. And if you want to put your questions in now, we will try our best to get to them. But I am just super excited, and we're going to just jump right into this conversation with Dr. Marita today. Again, she is an American public health expert. She is on the President Joe Biden's COVID-19 advisory board, and she is the vice president at the Robert Wood Johnson Foundation. And she was a previous commissioner of the Chicago Department of Health and many, many other places that I think converge at this moment as to why it's so important for the Head Start community to hear from you. So welcome today. We're very excited to have you, and thank you for joining us. And so we're just going to get right into this Q&A, if that's okay with you.
Sounds great. Thank you so much for having me, Dr. Patrell. Nice to meet you.
Thank you. Likewise. So we're going to get started, and just ask you at a high level, what do we know about the safety and efficacy of the current vaccines from your medical perspective? And I know we just had the conversation from that with many leaders in our community. And really what we're hoping is if you could help us with what questions we should be asking about the information that we're hearing and the information that's being rolled out.
Yeah, that's such a great question. I think that one of the reasons that people have concerns or are uncertain about the vaccines is because the speed at which the vaccines were actually developed and produced. Typically, we have years to anticipate a new vaccine, but these vaccines were developed in months and produced, mass quantities were produced and were out in the communities within less than a year, which is really unbelievable. The key thing to focus in on is that there were billions and billions of dollars that were invested in the production and manufacture of the vaccine so that it could be done quickly. And there's a lot of coordination that happened between manufacturers and federal agencies to make this happen so quickly. But the review process to look at how safe and how effective the vaccines were, there weren't corners that were cut. That same process that is used for all of our childhood vaccines that all the Head Start kids get routinely and are required to get, actually, that those same process that was used to evaluate how safe and effective those vaccines are was also used for these vaccines. And what we found was the vaccines are highly effective, 95% effective. The Moderna and the Pfizer vaccines are 95% effective. And though there are side effects after people get vaccinated, in terms of muscle aches, soreness at the site, headache, sometimes people have fevers, feel sick after the first couple of days after getting vaccinated. The long-term side or the major side effects or needing to be hospitalized because of severe side effects are really, really rare. And so it's really in the context of a really severe disease that's impacting so many people. Getting the vaccine makes a whole lot of sense. But I think because the vaccine was produced so quickly, it just didn't give the public or even healthcare providers a chance to really understand what these vaccines were all about. So it made it at first people are hesitant. But what I'm hoping is that people that are hesitant are watching to see that now tens of millions of people have actually gotten the vaccine already and are doing quite well. So I'm hoping that that's reassuring to people and that people will feel comfortable getting their vaccines.
Thank you. Thank you. Now, True, you're with the Head Start community. You're a great friend of the Head Start community. And one of the principles or the values is the authentic listening and engagement and really, leading from who we are and the empowerment of families in terms of hearing their stories. So we wanted to invite you to share or lift up your own story. Do you have a personal story that you'd like to share, especially around the issues of the vaccine equity, racial justice, and why that is so important to your work as we kind of dig into a little bit of the vaccine information? I wanted to just pause and give you an opportunity to share a little bit about your perspective and your background.
Right. So I think from a personal perspective, racial equity is really kind of something that's core to who I am. My parents are Japanese American and were actually interned in camp during World War II because they were felt to be a threat to national security. And so Japanese Americans, tens of thousands of Japanese Americans were actually put in internment camps. My parents relocated to Chicago shortly after being in the camps so that they could actually get out of the camps. If they moved to Chicago, it was felt to be safer because they weren't along the coast. And when they arrived in Chicago, they actually received a lot of support from the community, Japanese American community that was here already, but then also other communities. And to me, I had a huge sense of appreciation that my parents who came here with nothing actually were supported and were allowed to flourish and to thrive, but it required support. They couldn't do it on their own because they came with nothing. And so I have this sense of giving back because of their experiences. My work in Chicago in terms of vaccines, as medical director for immunizations, we went into communities to really understand why kids weren't getting vaccinated, because we saw that African American and Latino kids in Chicago didn't have as high coverage levels as white children in Chicago. And so we went into the communities and really got a sense of what was going on in the people's lives that they weren't actually able to get the vaccines, and focused our resources and our attention in making sure that we were listening and hearing to the communities about what their needs were, what the challenges were, and then trying to address those needs because it's competing priorities. If you can't put food on your table, that will take priority over getting your child vaccinated. And so really understanding that if you don't have a car, then making sure that the vaccine clinics are located within your communities is really critical. So what I learned from that experience was really the importance of listening and understanding what the lives are like of the people who aren't getting a service or whose lives are severely impacted by a disease, and seeing what it is that they need to be able to be healthy, because it's got to be the systems and structures that are in place to really support them.
Thank you. And I appreciate you lifting up the community support as a guiding principle. Thank you so much for sharing that. I appreciate your story. So we want to turn a little bit back to the vaccine and mostly your leadership in it and your leadership in this work. And so you recently wrote a op-ed in USA Today that was a real wake-up call around equity with the COVID response and then also the vaccine distribution. So for our attendees today, can you talk about how the current response is failing to live up to the principle of protecting the communities that need it the most? And also, can you share what level of confidence you have that in the next few months, the overall response to this pandemic and the vaccine rollout will improve?
Yeah, to start with, I think what I would say is that, at the beginning of the pandemic or early in the pandemic, it became clear that there were certain groups that were being disproportionately impacted by the outbreak. So you could see that our Black and Brown communities were actually having higher rates of hospitalization and death because of COVID itself. And because of that, Robert Wood Johnson Foundation put together some health equity principles that outline things that state and local health officials could actually do to make sure that their responses and also the recovery were equitable. And one of the key elements of that kind of an approach is really having disaggregated data. So understanding who's getting sick by race, ethnicity, other factors, occupation, neighborhood where you live, but not just who's getting sick, but then also who's getting tested, who's getting vaccinated, because we can't in public health know how to respond unless we have, if our responses are actually reaching the right groups. Who's at highest risk really needs to get the vaccines, needs to be tested, need to have access to healthcare services. And so having data that tells us that specifically is really important. What we're seeing play out right now is that the data that are available regarding vaccine coverage levels is incomplete. The CDC issued a report last week on Monday that showed that 50% of the data related to vaccine coverage is actually available by race and ethnicity. And that makes the data very incomplete. And so we don't have a good picture of who's getting the vaccine and who's not. What's more concerning too is that even with the limited data that are available, Black and brown communities are being reached less effectively as the white communities. And so I think it's important to have data. It's also important to have complete data. And then it's really important to use that data to then change and modify the programs. The vaccination programs are early in the course of their maturity. We have time to fix them and to make them better. And I know that state and local health departments are actually working on their responses to improve their access, the access of these vaccines to the communities who are at highest risk for disease. So I've talked to a number of state and local health departments, and they're doing things like working with community health workers. And it could be people like Head Start employees as well, who are in the trenches, working so closely with some of our communities that really are at highest risk, working with these groups to actually have them educate people and make information about where the clinics are, how to register for the vaccines, make it easy for them so they can easily access the vaccines as well, but also scheduling the clinics in times when people can access them. Not everybody can take off time from work. So having the clinics after hours, on weekends, making sure that they're easily accessible within communities, because not everybody has a car that can drive to a drive-up site. Making sure that there's phone banks so that people can actually call in and it's not dependent on high-speed internet, because that's a challenge for many communities as well. So the state and local health departments know that they need to do this kind of work. The challenge for them was that in the initial rollout, as much money that went into the vaccine development and manufacturing, very little money went to state and local health departments who were supposed to actually do this work and get the vaccines into arms. So it's great to have vaccine available, but unless those who need to vaccinate are getting resources to do that work, the vaccination efforts won't be as effective and won't be as equitable as they need to be. And so there is funding now starting to flow to the state and local health departments from the federal government to ramp up these systems, but it's going to take a little time. And so though the rollout hasn't been as smooth or as fast as we'd like it to be, I'm hopeful that now that dollars are flowing, that they'll actually start, these programs will start doing better in terms of data collection, data reporting, support systems for people who are at highest risk for getting disease so they can actually get the vaccines that they need.
Thank you. Thank you. And you talk a little bit about the health equity principles from the Robert Wood Johnson Foundation. I'm wondering, do you want to share any more about how a program or like the Head Start community can lead, or is there anything they can do to help the states and localities remove those barriers?
I think with the Head Start community, you have access to people who are at greatest risk for being sick and getting hospitalized and dying. And so understanding from them what their concerns are about the vaccine is really important, because if the Head Start community has information about what's driving this hesitancy, if there is hesitancy, is really important, because we need to listen and hear from the community what's going on and what are the challenges. The other thing is because Head Start leaders have access to the community to share information, and because you all appreciate and understand science and data, that you can actually share that information with the communities who are at greatest risk and your trusted sources of information. So when Head Start community says things, the community can listen and trust it. And so that's important as well, because not everybody trusts the local state health official. Not everybody trusts the CDC. And so having the messaging coming from all different routes, and also just being consistent. Like if Head Start community is saying the same thing that the state health agency is saying, and that's the same thing as the CDC is saying, that's really reassuring to the people who are wondering, is it safe to get a vaccine? And I think we were kind of lacking that last year. There was inconsistent messaging. Some governors were saying something, the president was saying another thing, local officials were saying other things. But if we can all get on the same page and really base it on the science and the data, I think we'll be more effective and successful.
Thank you. And as you talk about the vaccine hesitancy, in the earlier panel, we didn't get to that question, but someone wrote in the question and said, how do I get my staff to, support parents getting the vaccine if they themselves are hesitant for it? So my question, maybe we could spend a little bit of time on that type of question, is what is your practical advice for Head Start leaders that are on this call about how to have this kind of conversation with families and their communities and their teammates in this rollout?
Well, I think this is a wonderful thing. I was sitting in on the session just before this, where you were having the physicians talking about how they handle the questions. What are the questions that people are actually experiencing? What you're doing is you're giving the answers to the questions, the most common questions, to the Head Start community, so that you all can be ambassadors to the community. Because in order for you to promote a vaccine, you have to feel comfortable in it yourself, and you have to have the answers to the questions yourself. And so this is a great effort to get that information into the community, Head Start community's hands, so that everybody needs to have the answers to the questions, so they feel comfortable sharing the science and the evidence that are behind it, providing resources. What websites are easy to read and easy to understand? And the CDC is working on information, but there's the American Academy of Pediatrics is really good about having information available that's easy to read for the public as well. And some academic institutions also have easy to read public information that's digestible for the public. So making sure that we're getting easily accessible resources and easily understandable resources to the community is really important. But the other part of it is, our health equity principles is really is about listening. That we don't just go in and say, this is the truth, and you should do this, but really hearing from the community. What are their questions? What are their concerns? What information do they actually need? And then trying to be responsive to those things is really important. Because, when I was in practice as a pediatrician early on, when a family was vaccine hesitant or didn't want to get vaccines or was refusing vaccines for their children, I would say, well, I'm sorry, I feel so strongly about vaccines and know how important they are. I can't take care of you. You need to find another pediatrician. But what I realized soon was that if I did that, they would actually find a doctor who wouldn't really work with them over time. And that was a missed opportunity, because just because a person challenges or questions a vaccine in the beginning doesn't mean that they will always be vaccine hesitant forever. If I work with them, if I earn their trust, if I continue to share information with them, provide the information that they need, or bring in other examples, or have them introduce them to other people that are more trusted than I am, that I can actually work with them to maybe, if not accept all the vaccines, at least some of them. So listening is really, really an important part of addressing this vaccine hesitancy. We can't just come in and expect that we're going to just dump a bunch of information on people and they're going to accept it and be ready to change their acceptance. So I think it's really a matter of listening, equipping ourselves with as much information as we have so that we can respond appropriately. And then also, if there are questions about whether or not someone is trusting someone else, finding the right people that they do trust to help answer the questions as well.
Thank you. That's very insightful, and I think I'll just lift it up what you shared about, because we were going to ask you the question, what message should the Head Start leaders impart? And it sounds like you're saying get the information and be confident in knowing what the information is, so that you can answer while you're listening. So there's not one response, because there's not a generally accepted reason that people aren't getting vaccinated. So did you want to share more about messaging that the Head Start community could kind of lean into around getting people vaccinated?
I mean, I think a lot of the questions are related to, so it's interesting because this is a little different than influenza, where I think people say, a lot of people that are hesitant to getting the flu vaccine will say, because I don't get that sick, or I won't get sick. COVID's a little different because we can see the numbers of people who are actually getting very sick and who are dying. And we can also we know that it's Black and Latino and Native Americans who are really getting impacted by this disease and really ending up in the hospital and dying. And so there's clear evidence about who's at risk and who's dying. And people know people. Everyone I talk to knows people who've died or been hospitalized because of COVID. And so it's important to lift it up in terms of, yes, this is a serious disease. This is a serious threat to our health and our communities, and we don't want this to happen. So just making that clear. The other thing is talking about the safety and the effectiveness of these vaccines. These vaccines are very, very effective, 95% effective in preventing infections, and even more effective in preventing serious infections. And so just lifting that up is really important. And then the safety part of it is where I think it's really important for people to be able to talk about having received the vaccine themselves. I love the fact that what we see is people doing it and demonstrating the fact that they trust the vaccine by getting vaccinated publicly. So either in the newspaper, on the radio, on TV, demonstrating their faith and confidence in the vaccine. That's very reassuring. So as Head Start leaders, if you've been able to get vaccinated and have been vaccinating, letting people know that you did it yourself or that your parents did it and you encourage them to do it. I don't know, as a pediatrician, I don't know how many parents ask me, did you vaccinate your kids? Because they wanted to know, do I believe in the vaccine enough and do I feel like it's safe enough to give to my own children? So being able to demonstrate your own trust and faith in the vaccine and your own experiences with it as well, really important in terms of earning the trust. And then also not expecting people to change their minds right away and being patient and being willing to work with them and engage with them over time is really important as well, because that's how trust is earned overnight. And I think it's really this kind of ongoing relationship we have with our clients or our patients to really help them to get more comfortable with accepting something that is new and can be a little scary if you don't have all the information that you need.
Thank you. Thank you. Those are 3 great points for messaging. Time went by so fast. I wish we could just spend the whole day with you. But as we close, I'm hoping that you could forecast for us a little bit, looking into the future, and share what are the odds that children in Head Start and all across the country may need to take an approved vaccine for children at some point, and should we be preparing for that too? And what other future focused things we should be thinking about as this community?
Well, I think so. The challenges that we have with the vaccines that have been licensed already is that they were not studied, or they're just being studied now in children, and so there aren't good data related to how effective they are or how safe they are in children. What is happening right now is they're doing studies that are enrolling children in them, but they can, instead of doing the study in the exact same way as they were done originally, where you have to give a vaccine and wait and see what percentage of people actually become sick with an infection. What can be done with children now is give a vaccine and draw their blood and look at their immune response to the vaccines and then compare it to the adults who actually we know these levels of blood immunity in the blood are what confer protection. And so you can now, instead of having to wait to see if these kids actually develop the disease, you can look at what their immune response is to the vaccine. And that's a quicker thing than watching over several months to see do you actually get sick. So there will be some data regarding how effective and how safe the vaccines are in children, but that's going to take some time. And right now, we don't even have enough vaccine for the adults who are really at highest risk. So what will happen as we roll out this vaccine program is that adults are going to remain the top priority to get the vaccine, and children will be later in the process because we don't have, until we have the data about safety and efficacy, and until we've actually vaccinated the highest risk people who are really the adults in the US or in the world, the children really won't be eligible for the vaccine for a while. So I don't have a crystal ball. I wish I did to say when we'd be able to vaccinate our kids, but I think that will be down the line and it will be months from now. It's not going to be in the immediate future. So in the meantime, there's plenty for things for us to do in terms of protecting ourselves. We know hand washing works. We know that social distancing works. We know that wearing masks really can protect those who are wearing the mask and then others around them. So continuing to do those kinds of things is really, really important while we're waiting for the vaccine to be licensed and available for children.
Thank you, thank you. And as a final question, and I know everyone's wondering, like, where does the time go? But we want to just ask you, because you're a leader, you're in the middle of this, and as well as the many people on the line. What are some final thoughts that you would share with this Head Start community who's not only in the storm, but also charged with navigating out of this, or in it rather? What are some final thoughts that you would have for this community?
So I have hope for us to be able to get out of this pandemic because we have these great vaccines, 2 great vaccines that are available right now. And we know things that can actually work to help prevent this spread. I have hope, but we have to be patient because the vaccine supply is not high right now. And the disease is still circulating and at pretty high levels right now. So there still is risk. So while I have hope, I also have recognized that we're not going to be out of this really quickly. And so it's going to take some time overall. I do feel like as Head Start leaders in the community and trusted voices within the communities, you all have great potential to help stem the tide and make this pandemic, minimize the devastation that's actually happening, has happened with our communities by leading on encouraging people to use the protective measures, mask wearing, social distancing, washing hands, and also encouraging folks to get vaccinated because trusted sources of information like Head Start play a critical role in terms of people's willingness to do what is right to do to protect the public's health. What we have lacked last year in terms of the response was really this kind of coordinated messaging. I am confident that CDC's messaging at this federal level, there'll be improved communication regarding what are the best practices, what do we need to do to stay safe, more and more vaccine will become available, but just really helping the communities that are so close to this and actually who have been hit so hard. The Head Start community has been working so hard already and has done so much important work, but it needs to stay strong and stay patient and keep going because your efforts will make a difference in terms of turning this pandemic around. And it is just a matter of time, but it's going to take more hard work and more patience and commitment to science, sharing science and listening to people and answering their questions.
Thank you so much. And I'll say it again, I wish we had a whole day with you. We really appreciate you spending this time with our community to just lift up things that we can do, messaging, information, resources. It's been very informative and we appreciate it greatly and also appreciate your leadership at the national level as we navigate out of this. Thank you so much for joining us today. At this moment,
thanks so much to you and to all the Head Start community for all that you are doing. Those kids are our future and you do fantastic work. So thank you so much.
Thank you so much. Now I'm turning it over to our NHSA Deputy Director, Tommy Sheridan, who's going to talk a little bit about what we're going to do next now that we've had this conversation and what the opportunities ahead for the Head Start community. Tommy?
Absolutely. Thank you, Bernadine, Dr. Futrell, and thank you to everybody who joined us today. I mean, I certainly agree with everything that Bernadine was just saying about just the opportunity for us to continue this. Such an important conversation and such celebrities that we got with us today joining our community and really celebrities and experts in this world. I think it's absolutely fascinating and really appreciate everyone spending their time with us. You know, it is clear that the COVID-19 pandemic has had an immense impact in the lives of the Head Start community across really every spectrum of our lives, bringing challenges and tragedy to the families we serve and our staff that provide the work that we do. As vaccine programs take root and as the need to access testing remains really paramount to our success as a Head Start program writ large, this is really an important time for our community as a Head Start community to come together for a candid conversation about how we move forward. How do we do that together? How do we do that safely? And how do we also do that while addressing the unique challenges our individual communities face? And so that's why today we're excited to kind of conclude our symposium here with the announcement of a launch of Head Start's National COVID-19 Testing and Vaccine Working Group. Or vaccination working group, I should say. This working group will gather expert thinking from you, the Head Start community, from Head Start programs, association leadership, parents and staff, the whole gamut of the Head Start community from every region, every state, and really try to grapple with questions related to navigating the vaccination efforts as well as the testing conversations and access to those within the Head Start community. These conversations will inform how we support one another, learn from each other, and really also inform the tools and resources that we at NHSA will be able to curate for all of you so that you can take it back to your programs, take it back to your communities, take it back to your staff, and really try to use that. By contributing to awareness, creating an understanding, and addressing deep-rooted fears, we believe that the Head Start community can really work towards our strong future in a post-COVID-19 world together. Which, my goodness, doesn't sound like a breath of fresh air for everyone. Now, in terms of specifics, this is really the key point here. The working group is an open invitation. That means you, everyone who's on this call right now, are invited. We invite you to support and inform how Head Start recovers from COVID-19 at the national level, and we really invite you to share. What types of resources, what types of information, what types of challenges are you going with? And let's use this working group as an opportunity for us to come together and move forward to be able to address the concerns within our community, but then also ensure safety of our children and families. And you may ask, well, what's the commitment of joining a working group like that? And we're gonna keep it relatively simple. 7 meetings across 4 different phases of work. Laying the groundwork for the success, getting some of the information that we need, messaging with meaning and compassion, leveraging collaboration and optimizing partnerships, and then finally maximizing our impact. You are obviously welcome to show up to all. We would encourage you to show up to all of the 7 virtual meetings, but if you can only make it to 1, that is okay too. Either way, we encourage you to participate to the fullest extent possible, especially in the pre-meeting surveys and follow-up email correspondences that we're going to be doing. This working group is how we take the important learnings from today and use them to build momentum to support Head Start as one united community dedicated to access to opportunity for our most at-risk children and families. We will be sharing more information later this week about exactly how to join and when those meetings are going to be scheduled. Presume that they will be starting to kick up probably early next week. But again, keep an eye on your email and we'll make sure everyone who had registered for this conference, this symposium, got that. So without further ado, I want to one last time, if we can all at home give a round of applause to all of our speakers and our guests, especially Dr. Futrell for her leadership in this conversation. And above all else, I wish everyone health, safety, and I hope that everyone in your program is doing as well as they can. We're going to get through this together, and I appreciate Dr. Marita's words of hope to conclude this out there. I think we as a Head Start community have a strong role to play in ensuring that our country can continue to hope and continue to recover from the pandemic that it is. Hope you have a good rest of your afternoon, and we look forward to seeing you on some of the working group calls in the weeks ahead. Take care, everyone.